안녕하십니까. 글로벌 코리안 포스트에서 전해드리는 글로벌 코리안 GK 뉴스입니다.
Networks Inherited Metabolic and Red Blood Cell Disorders Clinic. I'd like to welcome the Honorable Eric Hoskins, Minister of Health and Long-Term Care, to the podium.
Is an important collaboration between two of Toronto's hospitals and the Ontario government that will have a positive impact on patients right here in Ontario. And that, what I referenced at the beginning, the creation of the triage nurse position for EDS at UHN was an important first step in our efforts to respond to the recommendations made by the EDS expert panel. And it would make referrals to specialists like geneticists, pediatricians, and pain management professionals. So, ladies and gentlemen, it gives me great pleasure to announce today that the EDS Clinic is now open. So I want to thank once again the Hospital for Sick Children and UHN for leading the operations of this clinic. Our government is going to provide them with close to $1 million to support the startup and operation of the EDS clinic, and of course will provide them with annualized funding thereafter. And I believe this clinic...
Minister of Children and Youth Services and Minister responsible for anti-racism, Minister Koto.
Sickle cell. This is a disease that has a devastating effect on the lives of many Ontarians. And this initiative today will allow for young people to transition into the adult system with care and with a particular focus, because we know more now more than ever that systems need to work together, and we need to figure out that transition point, that bridge that allows for systems to have that natural flow, so young people transitioning to the adult system have the ability to get the best care possible. So I wanted to be here today just to say thank you so much.
This announcement is truly fitting. It's a truly fitting way to celebrate Rare Diseases Day, which is happening tomorrow, February 28th. And as co-chair of the EDS expert panel, it is particularly gratifying to see this clinic come to fruition. It was beyond our scope to make this recommendation, but we all felt very strongly that this group of patients required an integrated and coordinated approach to care, and we really appreciate the government and listening to that recommendation and acting on it. This model will allow us to better serve patients with Ehlers-Danlos syndrome and other rare diseases. Building on our current expertise, we know that over time, through this dedicated clinic, we will develop a deepened understanding of EDS and how to most effectively support patients suffering from this disease and their families. We will...
Special guest, Lauren, who was diagnosed with Ehlers-Danlos syndrome 3 years ago. Lauren.
And I have Ehlers-Danlos syndrome, or EDS. I'd like to tell you a little bit about what this new EDS clinic means to me as a patient and why this announcement is so important to the EDS community. Let me tell you a little bit about my story first. At around age 13 or 14, I began to experience symptoms that were becoming more and more unusual. Frequent, recurring, full or partial dislocations in multiple joints, along with chronic and widespread pain. Finally, just before my 17th birthday, I actually found out what was wrong with me on the internet. I printed academic articles and took them to my pediatrician, asking her if she thought that I could have EDS. She admitted she didn't really know much about it. She'd only treated one patient with it before, but eventually I was referred to Mount Sinai's genetics department. Only after waiting several months, in fact almost 2 years, was my diagnosis of EDS hypermobility type confirmed. Dealing with this diagnosis and this illness was another matter. There was no Canadian centre where my physician could go for information or assistance. There was very little research into what treatments might be helpful. There was a lot of trial and error. I wound up being followed by multiple specialists across different hospitals, altogether 6 hospitals in 3 different cities. It became a whole other job following up on these appointments. I was already in university classes full-time and working 2 jobs on campus. I had to rearrange my class schedule so that I had 1 or 2 days off a week in order to be able to commute between all of these different appointments. It was both costly and time-consuming. I started to have to carry with me a binder full of clinical notes, test results, medical imaging, and my own notes from meetings with specialists because being in so many hospitals in so many cities, it was difficult for them to communicate with each other. The only thing at that time that was keeping me from slipping through the cracks in the medical system was myself. EDS is a complex multisystemic disorder. It does not affect just one part of me, it affects every part of my body and everything that I do. I have daily chronic widespread pain in almost all of my joints. I can dislocate or partially dislocate joints all the time. For example, when I type on a computer, I have to stop every couple of minutes and put back joints in my fingers, in my wrists, in my elbows, and in my shoulders. I have to put them back where they should be because they can't stay there by themselves. The new EDS clinic that is opening today at Toronto General Hospital represents a tremendous step forward in the care available for EDS patients in Ontario. One of the reasons that this clinic is so promising to myself and to others with EDS is that it does offer that promise of coordinated care, of being able to see multiple specialists in one location rather than having to commute ourselves between all of those specialists. Additionally, I'm encouraged that it will provide key information for family physicians who have been long trying to coordinate our care without much support or direction. I am optimistic that it can provide the basis for further needed research into all aspects of Ehlers-Danlos syndrome. I am grateful to Dr. Eric Hoskins and the Ontario government for their commitment to all of us to ensure that we can finally get the care and treatment we need here at home in the province of Ontario. On behalf of myself and other EDS patients, thank you for taking this positive step forward and helping to improve the care for all EDS patients in Ontario.
To all the patients with Ehlers-Danlos syndrome, including Lauren, today's announcement is our way of showing that we've heard you, that we really have listened to your concerns. So patients living with Ehlers-Danlos syndrome will now have access to a hub of expertise, either through the Toronto General site or through the Sick Kids site, where they can access the care that they need and a spectrum of specialties in a coordinated and timely manner that's really structured around their needs. Our 2 clinics will work together as one program, providing a seamless transition for children and adults to build up expertise and knowledge about the illness, which we will share with primary care physicians, the community, and most importantly, with patients and their families. This will help us to evolve into a center of excellence in diagnosing, treating, and understanding EDS. Under the direction of Dr. Roberto Mendoza Londano, the Interim Division Chief of Clinical and Metabolic Genetics at Sick Kids, multidisciplinary teams will work together with patients to develop new strategies that will help them to lead full and productive lives. On behalf of our 2 hospitals and staff, I'd like to...
Of the ILC Foundation, a national, charitable, leading foundation which advocates for and provides community support to people with Ehlers-Danlos syndrome and chronic pain. A warm welcome to Ms. Sandy Smink and Ms. Rebecca Mills.
And the members of the press, hello. I'm Sandy Smink, and this is Rebecca Mills. 6 years ago, when Rebecca and Chris Mills approached the ILC Foundation to ask if we would take on EDS and chronic pain as a permanent charitable focus, Rebecca and I were told by Canada's leading pain specialists that EDS is so rare, we'll never see it in our lifetime. Today, with the advancements of awareness and education, of the 20% of Ontarians that live with chronic pain, it is estimated that 1 in 100 will end up with a diagnosis of EDS. Through the advocacy of patients who have publicly given voice to their experience in the healthcare system for what their needs are, and to the Crawford family who shared their story through an 8,000 signature petition, and through the support of the ILC medical advisors, of whom many are here today. Dr. Guzman, Dr. Mendoza, he's not here, but Dr. Buckley and Dr. Alan Gordon, who have helped the ILC in championing this cause by being co-chairs of our EDS conference that we host every year in November, which is CME accredited through McMaster University. But most importantly, it's through Minister Hoskins that you initiated an EDS leadership panel and brought together multidisciplinary specialists to really identify what the problems are and meet with them.
Thank you to all of you as guests for coming today. Now this concludes the formal portion of our event today. Thank you for attending. And Minister Hoskins has kindly agreed to answer questions from the media, and I think prefers to do it.
Providing today specifically for metabolic diseases as well as rare blood disorders. I think that gives us the opportunity to look at how we can not only make that expertise more broadly available, but as you've suggested, ensure that other parts of the province are able to provide the level of care that Ontarians should expect.